guys, welcome to this video. This is a highly requested video, especially for new grads or nurses that have been nurses for less than 5 years. I want to talk about how to talk to the doctor to get what you want. The most common thing with new grads that I have trained and new grads that I've worked with is that they are petrified to talk to the doctors. They're like the Greek gods that are untouchable. Listen, doctors are people just like you and me. They're moms and dads, they're sons and daughters, they're sisters and brothers, and they just want to get home to their regular life, okay? They're also bombarded with responsibilities and duties and patients, and they just want to get things done efficiently, just like the nurses. They also make mistakes like everybody else, and even though some doctors lack the humbleness gene, I feel like the next generations, especially the generations that are becoming doctors now and that are young doctors, they're really humble and they're really realistic and they don't have a God complex and they're ready to work together with all levels of healthcare. So I think that's a great change that's coming about. So if you are ever hesitant or scared to talk to a doctor or to talk to some kind of provider, I have some tips and tricks to make you look like the most awesome and knowledgeable nurse in front of everyone. Tips before you call the doctor. Have all of your labs, orders, allergies, current MAR, medications, that kind of stuff handy before you call the doctor. And I'm actually reading from my Resources for Registered Nurses ebook. You can purchase this ebook on my website. I'll put a link below in the description so that you can get that. It's super helpful. I include this topic, how to talk to doctors. I also have a bunch of stuff about how to start an IV, EKGs really made simple, how to give effective report, how to do a quick head-to-toe assessment, all that kind of thing. So definitely check that out. Sidetracked. Okay. So definitely have all that stuff in your hand or have it handy, have it pulled up on a computer as you call the doctor in case they ask any questions. You don't have to say, oh, hold on, let me look it up. You can just kind of click to the next screen and say, this is when they had their last whatever. This is what their potassium was today. This is their allergies. Quick, quick, quick. Nobody's wasting anyone's time. Also have a pen and paper ready to write down orders just in case you get any or any tests or anything. It's easier to write it down instead of trying to put it in the computer. Definitely write down what they tell you and then put it in the computer as an order, or maybe the doctor will do that if it's a really great hospital. I'm going to give you a sample conversation, and I have a sample conversation like this in the ebook that you can read, but it's very helpful. This script conversation comes from 10 years of nursing experience, and after you do it for 10 years, it's kind of so mundane and the same, and you realize what doctors want to hear and what they don't want to hear, and what nurses want to hear and don't want to hear. So let's come together to a mutual place, and I'm going to tell you exactly what to say to the doctor, exactly what the doctor is probably going to say back to you, and how to move forward. Let's do this in the most efficient way possible. So, script, the RN. The doctor answers. The RN says, hello, Dr. Rodriguez. This is Meg on PCU. So you identify yourself. You identify them, identify yourself, tell them where you're calling from. I'm from ICU, PCU, from MedSurg. Tell the doctor, you are taking care of Mrs. Smith, the perforated bowel case in room 4408. The doctor, yeah, like what's happening? What's going on? Immediately, why you're calling. I'm calling you because she has a fever of 101.7 and her white count is 52 today. So you came in and the patient just doesn't look great, has a high fever, has a high white count. Oh shoot, she just had fever. Hopefully she's not turning septic. Hopefully she doesn't have an infection. And you're calling the doctor to let him know there's a change in this lady's status, something we should watch and care for. Now the MD answers. This is so common, okay? This is so common. The doctor answers, okay, I'm not really familiar with this patient because doctors do shifts too. They're not on 24/7 from the time the patient's admitted to the time the patient's discharged. So this happens 75% of the time. Okay, I'm not really familiar with this patient. How long has she been having fevers? What was her white count yesterday and the day before? Is she on antibiotics? What day post-op is she? And if you have all the information up already, you can answer these questions quickly and concisely. So you want to give a clear picture of your concerns and how we can promptly fix the patient as quickly as possible, because we all know sepsis is like a death sentence. It is like the worst thing. You want to avoid it completely, especially after any type of surgeries or weird interventions. And if the if the doctor is not concerned with your concerns, always notify the doctor early if you're concerned. And you're better safe than sorry in the nursing world. If you call a doctor and the doctor doesn't care, that's okay. Document your response. You can always bring your concerns to another consulting doctor. Let's say the surgeon comes in instead of the admitting doctor, and you bring to him your concerns. Maybe he'll address it, but always address your concerns early and then document somewhere in the chart that you have called the doctor and expressed such and such concerns. Just to cover your bottom. Everyone's heard that phrase in nursing. Now, let's say the doctor is concerned and says, wow, thank you so much for calling me. I'm going to give you some orders. As he's giving you orders, write them down and always repeat the order back. You always want to repeat the order back. You don't want to just take it, okay, thanks, bye. Always confirm, because doctors and nurses are from all over the world. That's the best part of healthcare, is that we are so integrated and interracial, and we have so many languages and accents, and it is just like a beautiful melting pot. I'm getting goosebumps. That's so weird. So sometimes our accents kind of conflict each other, and sometimes we don't understand each other, and sometimes they need to be repeated. So if you don't understand the doctor, or the doctor doesn't understand you, repeat it. Repeat it. Spell it out as many times as you need to, because what's more important is the patient's outcome, and not if you're embarrassed to repeat it, or if he or she is embarrassed to repeat it. It doesn't carry a little embarrassment for the day for the sake of the safety of the patient. Okay, and then when you get your orders or when the conversation is done, always thank the doctor. I mean, it doesn't take very much to thank them, even if they were rude or if they weren't as polite as you expected, especially if you call them in the middle of the night shift nurse. Just thank them. Keep the positive attitude, even if they have a negative attitude, because it's almost like adding fuel to the fire when you give into their rudeness or when you give into their negativity. But if you meet that negativity with positivity and a great attitude, it throws them off their game. And sometimes they don't know what to do with it, and sometimes it causes them to totally reevaluate, and then they end up being nice to you. It is a wonderful thing. So don't let a rude doctor or a rude practitioner ruin your day, and don't be the rude one that ruins someone else's day. Keep that positive attitude, even if you have to fake it sometimes over the phone because you're at work. Sometimes you gotta fake it at work. Sometimes you have to have a positive attitude when you don't really feel like it, because it maintains that professionalism. And you are a nurse and you are a professional.